Good afternoon, everyone. My name is Patty Dorn with the Consumer Education and Advocacy Unit of the Maryland Insurance Administration. Today, I'm going to be talking to you about the Medicare supplement in Maryland. Thank you for the slides. Just a few housekeeping. If you can, please keep your phones and computers on mute. Cameras off, and for questions, please utilize the chat. This is a relatively long presentation. I have an hour and 15 minutes set aside for it. Maybe we'll need it all, maybe we won't. Feel free to ask questions at any time in the chat during the presentation. If it's relevant to the topic that I'm talking about at the time, I'll try to take your questions in real time, but I'll also have a Q&A at the end. If you have questions that are really specific to your own situation and that require potentially sharing personal information, you might want to just shoot me an email at patricia.dorn@maryland.gov. That email address is at the bottom of this first slide, and I'm going to put it in here. That said, if it is a really specific question, I'll probably ask you to email me so we can discuss it one-on-one in email or over the phone, etc. But feel free to put those questions in the chat as I go through this. So with that, I am going to turn my camera off and get started. All right. Medicare supplement in Maryland. This presentation does not provide legal advice. You should discuss specific questions with your trusted financial advisor or insurance producer. Next slide. We're going to talk about the Maryland Insurance Administration, our agency, what we do. I'm going to do a review of Medicare. I've found that is important because it's really, really important that you understand where the Medicare supplement product fits into the big picture of Medicare itself. Because, oh yeah, thanks, Joyce. Oftentimes people come to this presentation and realize, oh, I don't need a Medicare supplement. In my big picture of Medicare, that is not necessary. And so let's review Medicare so we can understand where the Medicare supplement fits. And then we're going to get into the details about the Medicare supplement. I'll talk about guarantee issue periods, and then we'll discuss some FAQs, some submitted questions that we've received. Next slide. So the Maryland Insurance Administration, who are we? What do we do? We're the state agency that regulates insurance in Maryland. And that means that we are the entity that licenses the insurers, so the insurance companies, the entities that sell insurance, and the insurance producers, your agents and brokers. We license both of those groups to do business in Maryland. We examine their business practices to ensure their compliance with Maryland law and any applicable federal laws that they must follow. We monitor the solvency of insurers. So we're making sure that those insurance companies that are doing business in Maryland, that are selling you insurance policies in Maryland, have enough money to pay your claims. We review and approve the insurance policy forms, so those insurance policies that you read and receive, and we review the insurance rates to ensure that they are not inadequate. Your insurance company needs to be charging you enough to stay in business and pay your claims going forward, but that they're also not excessive or unfairly discriminatory. And we investigate consumer and provider complaints and allegations of fraud. What that means to you is if you have an issue with an insurance company, an agent, or a broker, you can file a complaint with us. And at the bottom of that last slide as well is a link to our YouTube page. And I just want to point out that we do have a repository of videos on YouTube that cover many, many different insurance topics in just a couple minutes. In many cases, we try to make them as user-friendly as possible. And I do encourage you, if you have questions, to check out our YouTube page repository of insurance videos. So if you feel that your insurer or your insurance producer acted improperly, you have the right to file a complaint with us. Just some examples: improperly denying or delaying payment of all or portions of a claim, improperly terminating, ending your insurance policy, raising your premiums without proper notice, making false statements to you in connection with the sale of insurance, or overcharging you for services. And those include premium finance charges. Our 800 number and our website is at the bottom here, 800-492-6116. And insurance.maryland.gov is where you can find us online. We're also Facebook, LinkedIn, Instagram, all that. Next slide, please. So what is Medicare? Medicare is government-sponsored health insurance for older adults 65 plus and younger adults with disability. It was created in 1965 and it was expanded in 1972 to include. So in 1965, it was for 65 plus. It was expanded in 1972 to include those under 65 who receive Social Security disability benefits and also those who have end-stage renal disease. The Medicare Modernization Act of 2003 established Part D. So I think that's important. Part D has only been around since 2003. It's not very long. Next slide. So this kind of is just different parts of Medicare, which I will review each part in detail as we go along. Next slide. So who's eligible? U.S. citizens 65 and older with sufficient quarters of work credit under Social Security are eligible for Medicare, and that is 40 quarters. So that basically means 10 years of work, or you have a spouse with 40 quarters. Adults under 65 with disabilities are eligible after they received Social Security disability benefits for 24 months. So in the 25th month, they are eligible for Medicare. Eligible with a diagnosis of ALS in the first month of Social Security disability benefits, and eligible at any age with end-stage renal disease in the 4th month of dialysis. Next slide. So let's start with A. The review of Medicare Part A. A, hospitalization. A is referred to as hospital insurance or inpatient insurance. It's funded by payroll tax, FICA, and most people with a personal or spousal work history who've paid into Social Security do not pay for Part A. So if you have that 10 years, that 40 quarters, then you generally receive premium-free Part A. Those who don't have the 40 quarters might have to pay the entire premium for Part A or part of the premium for Part A. Part A covers care at a hospital, some costs of skilled nursing facilities and home health services, as well as hospice care for the terminally ill. Next slide. Part B. This is often referred to as outpatient insurance. And when you sign up for Medicare Parts A and B, you'll receive a red, white, and blue card. It has two little parts. One will say the date that you started Part A, and one will state the date that you started Part B. Not always the same date. So Part B, outpatient insurance. Part A and B together are referred to as traditional Medicare or original Medicare. You'll hear both. They're funded by Part B premiums. In many cases, you pay the Part B premium. If you qualify for the SLIMB or QUIMB Medicare savings programs, you will not be responsible for your Part B premium, but it is funded by the Part B premiums and general revenues from the federal government. So the Part B premiums alone do not cover the costs of the program. The Part B covers doctor's services, lab tests, medical equipment, ambulance services, prevention and wellness screenings, orthotics, prosthetics, and mental health services. There is a permanent penalty for late enrollment, 10% of the base premium for each year you delayed enrollment. So I'm going to take a minute and talk about that because I already mentioned that some people don't start A and B at the same time. Well, often you turn 65 and you're still working and you're still receiving health benefits through work or through a spouse's work. You don't have to take Part B in many of those circumstances. If you don't take Part B and you have what is considered creditable coverage, then you will not be penalized for late enrollment. Now, you might still be enrolling, instead of at 65, at 68 or 70. but you won't be penalized for that. However, if you turn 65 and you don't have what is considered creditable coverage, and you don't enroll in Medicare Part B, you could be looking at a permanent penalty for late enrollment, 10% of the base premium for each year due to late enrollment. And that is a permanent penalty. So if you don't sign up for Part B until you're 70 and you spent those 5 years, without coverage through work, etc., and then you sign up for Part B, you could be looking at paying 50% more than everyone else is paying for Part B for the rest of your life. Next slide. All right, so this is where it starts to get maybe a little bit more confusing. All right, so there's your A and your B, your hospitalization and your outpatient. You have the red, white, and blue card, and that covers approximately 80% of the cost of your Medicare. Now that's approximate. That leaves 20% that needs to be covered. And there are 4 main ways that people get that 20% covered. The first one is through the Medicare savings programs. People that are lower income oftentimes qualify for the QMB program. And you can find out about that program through your local SHIP or social services. You could apply for this program, and that could cover the 20%. There's also some people that qualify for Medicare, Medicaid. So their Medicaid is covering that 20%. So some people get that 20% covered that way. Others have retiree health benefits through work. So you retired from state government, federal government, from a large employer, and you're going to continue those health benefits potentially for the rest of your life. In many cases, that covers the 20% for you. But if you aren't at the lower income level where you qualify for those, for that QMB program or Medicaid, and you don't have the health benefits through retirement, then you're likely deciding, do I want an Advantage plan or a Medicare supplement plan? The Advantage plans are also called Part C, and the Medicare supplement plans are what we're going to spend most of our time talking about today. But it's important to understand Part C Advantage plans. All right, so Part C Medicare Advantage, those are plans that are offered by private companies under a contract with Medicare to provide Parts A and B coverage. They may also offer D coverage, and it usually does also bundle D as in drug coverage. Now, just to take a step to the side real quick, the Medicare supplements do not cover Part D. So if you purchase a Medicare supplement, you are absolutely purchasing a separate Medicare Part D plan. But most of the Medicare Advantage plans do bundle those all together. Now, everything's bundled. So when you have a Medicare Advantage plan, you're only using that card that that insurance company has sent you, because A, B, D, and parts of what's not covered under A, B, and D are covered under that one card. The Medicare Advantage plans may offer additional benefits not covered by original Medicare, such as vision and dental services. So that is also an important distinction between the Medicare Advantage plans and the Medicare supplement plans. The Medicare Advantage plans tend to offer more of these bells and whistles. Vision coverage, not covered under Medicare. Dental coverage, in most cases, not covered under Medicare. But oftentimes these Medicare Advantage plans do offer, at least it's limited, but they'll offer some benefits for vision and dental, and they can offer other things like gym memberships, meal plans. In some cases, they give you back some or all of your money for the Part B premium. There can be a lot of add-ons with these Medicare Advantage plans. The beneficiary still pays the Part B premium. Your Advantage plan will likely have a premium. You're still going to pay the Part B premium. I did mention that some of them help you pay with the Part B premium. Again, those are just things that you need to learn about the plan, the kind of bells and whistles and the ways that the plans are designed. These plans are going to have copays when you see a doctor, when you see a specialist, when you're hospitalized. There is going to be a schedule. The benefits will be laid out for you so you can understand in each situation what you are going to pay out of your pocket. So with the Advantage plans, you're going to have copays for most things. Hospitalization might run you $100, $200 a day. Pay attention to what your out-of-pocket costs could be with these Medicare Advantage plans. You're going to be in a network. Pay attention to the network. That is very important. Make sure if you're signing up for a Medicare Advantage plan that those doctors, those providers, those specialists that you want to see are in your network, because in some cases you won't be able to go out of network. Pay attention to that too, whether or not you are allowed to see doctors that are outside of your network. Now, this is an important distinction between the Part C Medicare Advantage and the Medicare Supplement plans. With the Medicare Supplement plans, you can see any provider who accepts Medicare who is currently seeing patients. You are not limited to a network with the Medicare Supplement plans. Just gonna check and see if I have any questions. Okay, so that's my spiel about Part C Advantage plans. I know you're here for the Medicare supplements. I just want you to know the difference so you make as informed of a choice as possible. Next slide. So review of Medicare Part D, D as in drugs. Part D is medication coverage. And remember, it's only been around since 2003. Before that, it was much less likely that your medications were covered under Medicare. It's provided through private companies, either as standalone plans or as part of Part C Medicare Advantage. Okay, so remember, Part C Medicare Advantage usually includes Part D. Not always, though. Pay attention if you're interested in those plans. Pay attention to whether or not drugs are covered under the plan. Medicare Supplement does not cover drugs. You have to purchase a D plan separately. So there's no pre-existing condition clause. They have to accept anyone who's eligible for Part D. It's important to know that different plans have different costs and different formularies, formularies being the drug lists. And the annual open enrollment for Part D is October 15th to December 7th. So as you know, because you can't avoid it, if you watch TV at all, et cetera, or get mail, this is open enrollment. Important. Open enrollment is for Part C Medicare Advantage and Part D. Okay, that's it. Remember that. Part C and Part D, open enrollment. The Medicare supplements are not part of Medicare open enrollment. And I don't think I lingered on the may incur a permanent penalty for late enrollment into Part D. So that's important to know. Just like with Part B, if you don't sign up for Part D and you didn't have any creditable drug coverage, when you do sign up, you're likely going to incur a penalty, and that penalty is going to last you the rest of your life. Next slide. Okay, so now we got through that 20 minutes, and now we're going to actually start talking about the Medicare supplement. The Medicare supplement is a product to supplement original Medicare. The Medicare supplement supplements Medicare A and B. It pays for cost sharing for parts A and B, but not for D. You purchase it from a private insurance company. There are 12 standard plans in Maryland, and you have a 6-month Medicare open enrollment period where you may purchase any Medicare supplement plan sold in your state without underwriting. So that first 6 months, technically it starts the day that your Medicare Part B begins. All right, so if you're turning 65 on March 15th and your Medicare Part B is starting on March 1st, then that is the first day of your 6-month Medicare supplement open enrollment period. However, don't wait until that day to start to shop for a plan. You want to set it up so that plan actually starts on March 1st, the same day that you start on B. But if you don't make it there for all kinds of reasons, that life throws at us, you still have that next 6 months to purchase a plan without underwriting. And I just want to just say real quick, if you have questions, throw them in the chat. Next slide. So some frequently asked questions. Is the Medicare supplement plan the same as a Medigap plan? Yes. And I know that's confusing. Medicare supplement and Medigap are different names for the same health insurance product. Some organizations prefer one name over the other, and some use both. Do the Medicare supplement plans cover prescription drugs? Well, you guys all already know the answer to that. It's no, generally, but some of the plans that were sold before 2006 do include prescription drug coverage. The policies sold since January 1st, 2006 are not allowed to. But some people have these grandfathered plans that do. Next slide. What about pre-existing conditions? Under federal law, the Medicare supplement insurers can refuse to cover your pre-existing medical conditions for the first 6 months. However, if you buy your policy when you have a guarantee issue right, the insurer cannot impose a waiting period for coverage of any pre-existing condition. And if you purchase the Medicare supplement policy during your 6-month open enrollment period, the Medicare supplement policy insurers must shorten any pre-existing condition waiting period by the number of months you had creditable coverage. Okay, I know there's a lot going on in this slide, so I'm going to try to make it really simple. Most people, when they enroll onto Medicare, start Medicare Part B, they had some kind of creditable coverage before that. Okay, but certainly some people don't. So during that 6-month open enrollment period, they must shorten any pre-existing condition waiting period by the number of months you had prior creditable coverage. So if you had insurance and now you're going on to Medicare, then your pre-existing conditions are covered immediately. It does get a little confusing here because the 6-month open enrollment period and a guarantee issue right aren't exactly the same thing. So with the second paragraph here where I reference a guarantee issue right, we will get into that in more detail in this presentation, because there are times where you may have had insurance with like a retiree plan, et cetera, and you lose those benefits, and then you're granted a guarantee issue right to purchase a Medicare supplement without underwriting. It's not quite the same as the 6-month open enrollment period, but it means the same thing. It means in both cases that you're not being underwritten. It means that the insurance company is not allowed to ask you medical questions, and they're not allowed to take your pre-existing conditions into consideration to decide whether or not they'll sell you a policy or what rate they will sell you that policy at. In both the situations of the 6-month open enrollment period and any guarantee issue right that you might find yourself eligible for, you are guaranteed the best rate that that particular Medicare supplement product is being offered at for your age. I hope that's clear. So for most people, they do not have to worry about this pre-existing medical conditions situation. Next slide. So what do we regulate? So the Maryland Insurance Administration regulates the Medicare supplement product, but we do regulate the Medicare supplement, but we do not regulate Medicare Advantage or Medicare Part D plans, except for solvency, making sure that they have the money to pay your claims, and producer conduct. Do you have a complaint against the agent or the broker who sold you that product? It's important to know that there are extremely strict federal rules that agents and brokers need to follow when they sell the Medicare Advantage and Medicare Part D plans. It's not part of this presentation. It is information that you can find relatively easily online. If you are curious about the rules that they have to follow, but if you just believe that they have misled you or broken those rules, you can file a complaint with us. So with regards to the Medicare supplement, we regulate the product. We look at the policy itself, the rates. We tell the Medicare supplement insurers whether or not they'll come to us for a rate increase, and we'll approve, not approve, adjust that rate based on our mathematical actuarial analysis that's done by our actuaries. And we also take the complaints from consumers. So your complaints about the Medicare supplement product can come to our office. Next slide, please. We enforce the insurance article of the Maryland Code and associated regulations. Here is the information about the relevant laws. And the National Association of Insurance Commissioners is an entity that proposes model regulations that most states follow to ensure consistency. And so that is a way of saying that you will see a lot of consistency with regards to state laws and the Medicare supplement. Next slide. So can the Maryland Insurance Administration help if I have questions about Medicare besides the Medicare supplement? So for the most part, you are so welcome to come to me with your Medicare related questions. But what I in general do is get your information and send a referral to SHIP. The Maryland Insurance Administration is the subject matter expert for the Medicare supplement, but not Medicare Parts A and B. We do recommend that you contact your local SHIP. That information, their link is at the bottom of this page. And CMS is the federal agency that administers the Medicare program. You can find that information at cms.gov. You can also always call 1-800-Medicare. But again, SHIP is definitely the entity that we would recommend that you call with these Medicare questions. Again, I can get you there as well. You can find the information on our website for all the local SHIPs. You can find it in our MedSup rate guide, and you can find it at the Department of Aging's website as well. So the Medicare supplements overview. The Medicare supplement plans are standardized. An F is an F is an F, a G is a G is a G. They are identified by a letter. Plans A, B, C, D, F, G, K, L, M, and N are currently sold in Maryland. Important. Medicare supplement plans A, B, C, and D are not the same as Medicare Parts A, B, C, and D. So I think that that's right along the lines of using Medicare supplement and Medigap for the same product name. Remember, Medicare supplement has plans A, B, C, and D, but that is not the same as Medicare Parts A, B, C, and D. And I definitely know that that's confusing. All the plans offer the same basic benefits. What that means is an A is an A is an A. An A is offering the same benefits, basic benefits, and F is offering the same basic benefits. Companies do not have to sell all plans, and you will find that in our rate guide. Not all companies offer all plans. There are certain plans, E, H, I, and J. They exist, but they're no longer sold. Those enrolled in the plans may keep the plans. C and F are available for purchase only to those eligible for Medicare before January 1st, 2020. So if you became eligible for Medicare January 1st, 2020 or later, you are not allowed to purchase Medicare plans C and F. That is because of a federal law that states that those who became eligible January 1st, 2020 or later are not allowed to purchase a Medicare supplement plan that covers the Part B deductible. C and F cover the Part B deductible, and so it's not available for those eligible 2020 or later. However, if you are somebody who turned 65 in 2018 or 2019, and you've been working, so you haven't started on Part B, you haven't purchased a Medicare supplement, you are still eligible to purchase C and F. It's when you became eligible, but you didn't necessarily have to start on Part B. And it's important to know that only the policy costs will vary between companies. That statement is a little bit simpler than the reality, because within the policy costs are the different ways that the policies are written. And we will get into that in a couple more slides. It might be the next slide. Next slide. Okay, so the standardized Medicare supplement plans, and I know this probably isn't huge on a lot of your screens. There's just a few basic parts of this that I want to highlight for you. You can find this exact chart in our Medicare supplement rate guide, but some important distinctions between the plans. So if you look at the asterisk at the bottom, plans F and G include a high deductible option. The deductible for 2023 is $2,700. Those are options, and you're going to find that those plans F and G high deductible options have some pretty low premiums. But again, you're paying the first $2,700 of your costs. It's important to know that that $2,700 does include those deductibles. So if you get an F and it covers that Part B deductible, and you buy the high deductible plan F, and that deductible is part of your first $2,700 of costs, you will be responsible for it. The same with the deductible for A. You know, if you find yourself hospitalized, you will be responsible for the first $2,700 in costs. Plan N requires a $20 copayment for office visits and a $50 copayment for emergency room visits. So that's just something to know. Much like the Medicare Advantage plans, now this Plan N has some copayments that you should be aware of. Other things that I want to bring to your attention. So you already understand that the Part B deductible is only covered under CNF. Let's talk about the Part B excess charges. The Part B excess charges are 3 up from the bottom in the gray shaded part. So Part B excess charges, and you will see that those are only covered under F and G. Only F and G cover Part B excess charges. So what are Part B excess charges? A provider who accepts Medicare can either accept Medicare assignment or not accept Medicare assignment. And if they do not accept Medicare assignment, then they can charge up to 15% more for your service or visit. That's the excess charge. So there's only 2 plans that cover those, F and G. It's also important for you to know that it's something like 98% of providers who take Medicare accept assignment. So not accepting assignment is not common, but it's a decent thing to ask your providers so you can understand whether or not you might be responsible for up to an additional 15%. It may not be 15%. Next slide. Hold on one second. I'm going to write something down. Okay, so rates. The Maryland Insurance Administration publishes a rate guide, which is available on our website. So over there on the side, that's what the cover looks like. You are welcome to download it as a PDF right from our website. You are also welcome, if you prefer things in hard copy form, you're welcome to shoot me an email and we can snail mail you out a copy of the Medicare supplement rate guide. We update it every January and July. So let's talk about that real quick, because the next version comes out January 1st. It will actually be a snapshot of the rates for one day in about late November. So when you see it in January, it was a snapshot of the rates of one day, let's just say November 28th. The Medicare supplement insurers can submit their filings, their requests for rate increases, et cetera, to us on a rolling basis. Okay, so there isn't one time of the year, this is always happening. So just so you know that the rate guide is a snapshot of 2 days essentially in the year and what the rates are. And those rates could change at any time. Most companies have a specific time of the year or month, that they file with us, but it doesn't all happen at the same time. So individuals should contact the insurance company to learn the rates in effect when they are applying. You're going to do that anyway because you're applying. There's discounts, and those discounts are all written out at the bottom of each insurer's page in the rate guide. There's discounts for multiple policies in the same household from the same company, and those household members do not necessarily have to be related. If you move out of Maryland, you might be able to keep your plan and your rate exactly as it is, but call your insurer and find out. Some insurers will rate you based on your new address. That could be good. That could mean a lower rate. That could mean a higher rate. In Massachusetts, Minnesota, and Wisconsin, you generally have to get a new plan because these 3 states have non-standardized Medicare supplement plans. So if you move to Massachusetts, Minnesota, or Wisconsin, you will get a 63-day guarantee issue period to purchase one of the Medicare supplement policies that are sold in their state without underwriting. So if you take advantage of that 63 days, you'll get a new policy for the best price, but it's just something to be aware of. Next slide. So this is what the inside of the Medicare supplement rate guide looks like. This is just one page, stripped of the specific insurer's information, because as the insurance regulator, we are not going to show favoritism toward one insurance company over the other. But this is just an example of what you're going to see inside the rate guide. Here we see the preferred rates. The preferred rates are the best rates available. This company likely also has a set of standard rates. So those would be if somebody is underwritten and they don't meet certain underwriting criteria, they might charge them more, give them the standard rate over the preferred rate. But you will get the preferred rate in that 6 months, that first 6 months on Part B, or anytime you have a guaranteed issue rate. And as you can see here, like I had said earlier, not all companies offer all plans. And then this just shows you that, we show the rates at under 65, 65, 70, 75, 80, and 85. And we show them in monthly rates. Next slide. All right, so I had alluded to this a little bit a couple slides ago. So because we have a sentence that says the only difference is the price. Fair enough. But the pricing, the carriers can write the policies based on 3 pricing techniques: issue age, attained age, or community rated. And to fully understand the pricing, you should understand issue age, attained age, and community rated. And it tells you at the top in the rate guide, where it shows you each company's name at the top right-hand corner, it tells you whether or not they're writing the policy issue age, attained age, or community rated. So if they're doing issue age, that means that the premiums are based on your age at the time that you purchase the policy. You can still see rate increases, and you will see rate increases due to benefit changes, inflation, increase in medical costs, but not due to your advancing age. Attained age means that the premiums are based on your current age, and those premiums will increase as you get older. Those increases may be in addition to premium increases because of benefit changes, inflation, or increasing medical costs. So important to understand. With the issue age policies, you might be looking at a higher rate starting out, but you're not going to see those bumps in rates based on your new attained age. But with the attained age policies, you will see a bump in your rate for each essentially birthday or a policy birthday for you. Community rated. Those premiums are not based on your age, either at the time the policy is issued or upon renewal. The premiums are based on other factors, and they may increase because of benefit changes or overall premium adjustments. So everybody is kind of in one big community with regards to the rates. Next slide. Can I be medically underwritten when I apply for a Medicare supplement policy? After the 6-month initial guarantee issue period, upon enrolling in Medicare Part B, you will usually be subject to medical underwriting for a new Medicare supplement policy. However, there are exceptions for additional guaranteed issue policies. So if you didn't purchase in that first 6 months and you want to purchase the policy later, it is likely that you will be underwritten. Next slide. So a little bit about the guarantee issue periods. For the individuals who are at least 65 years old, for the 6-month period following first enrollment in Part B, the insurer may not deny the policy, limit coverage, or increase rates based on the health status or claims history of the applicant. Next slide. Under 65. All right, so just a little note at the top, as of January 1st, 2020, Plan D has replaced Plan C. Again, so those eligible January 1st, 2020 or later cannot purchase Plan C. Plan D is the equivalent. It just lacks the Part B deductible coverage. So this is a Maryland law, not a federal law. For individuals who are under 65 and eligible for Medicare due to a disability, Plans A and D must be available for the first 6 months following enrollment in Part B of Medicare. So just like those 65 and older, 6 months following enrollment in Part B. However, with SSDI, sometimes you are awarded SSDI more than 24 months into your disability. If the applicant is notified by Medicare of retroactive enrollment in Medicare for the first 6 months following the notice, so they still get the 6 months. And the Plan A or D may not be denied, have coverage reduced based on the health status or claims history of the applicant. This is a little bit of a complex line here, the last bullet point. For a guarantee issue Plan A, the premium rate may not be higher than the average of the premiums paid for all policyholders age 65 and older in the state who are covered under that Plan A form. That is complicated, and what that's saying is that the rates for those that are under 65 tend to be pretty high. They're looking at a population that has presumably pre-existing conditions. Those rates do tend to be high. So for the guarantee issue A, the premium rate may not be higher than the average of the premiums paid for all policyholders 65 and older. And this is for those that are under 65. Next slide. All right, the Medicare supplement birthday rule. So this is new. Some of you might already know about it. Starting on July 1st, 2023, Medicare supplement policyholders in Maryland will be granted a once yearly open enrollment period during the 30-day period following the policyholder's birthday. The birthday rule establishes a guarantee issue period each year to allow a policyholder to change without underwriting to a Medicare supplement policy of equal or lesser benefits. You do not have to stay with your current Medicare supplement carrier. All right, so you have to be a policyholder. If you are a Medicare supplement policyholder, once a year, the date of your birthday and 30 days after, you can change to a Medicare supplement policy of equal or lesser benefits. You could change to a Medicare supplement policy of lesser benefits within the same company that you're with. You could change to a Medicare supplement policy of equal or lesser benefits with any of the carriers. You do not have to stay with your current Medicare supplement carrier. Medicare supplement policy holders who have been underwritten. So you came into the game late, you were underwritten, you're paying a higher premium. Medicare supplement policyholders who have been underwritten and received less than the preferred rate are entitled to the preferred rate during the guarantee issue period. So during this birthday rule, if you have been underwritten, you want to change plans, you are entitled to the preferred rate. Next slide. All right, Medicare supplement policies are considered to have equal or lesser value unless the policy contains one or more significant benefits not included in the Medicare supplement policy being replaced, or the policy contains the same significant benefits included in the policy being replaced, but reduces the cost sharing responsibilities. So I kind of feel like, this something that some of you might want to know, but it might be a little bit more detailed than some people are looking for. So on the next page, there's actually a chart that makes this a lot easier to understand. It's important for you to understand that insurers will be required to send each Medicare supplement policyholder an annual notice of their right to switch at least 30 days, but not more than 60 days before your birthday. So you don't have to put this in your planner. I mean, you certainly can. But you are by law supposed to get notice. You're supposed to receive a reminder in the mail, or, if you have elected to receive email, then in your email about this every year. Next slide. Okay, so this is the one that sort of really helps you understand what the previous slide was saying. So it shows the existing plans, and then it shows the lesser or equal plans. And so if we just go with a common plan like G, okay, I have a G. It's my birthday. What can I switch to? You can switch to A, B, D, high deductible F if you are eligible. G, high deductible G, K, L, M, or N. Again, though, if you're in plan B, the only thing that is less or equal to you is plan A or B. And so that just spells out for you what your options are. Of course, remembering that if you were eligible for Medicare 2020 or later, you are not going to be eligible for C or F. I won't linger on this too long unless somebody has some questions about it. But again, you can request the PDF of the slides from me after the presentation at patricia.dorn@maryland.gov. Next slide. Here's some additional resources. I mean, obviously during the presentation, you can't click on them, but we have a consumer advisory on our website, which should be relatively, if you just went to insurance.maryland.gov and looked up consumer, if you just search for Medicare supplement birthday rule consumer advisory to come up. Otherwise, you can just click on the link from the slides, and then we have links to the regulation as well. Next slide. All right, so this I'm gonna speed through this a little bit. If you want to know about these other guarantee issue periods, I recommend that you know that this resource is available to you. These slides have been written up, and you know who to get them from, or you talk to somebody from SHIP. So after the initial guarantee issue period, individuals will usually be subject to medical underwriting outside of the birthday rule for new Medicare supplement policy. Federal regulations set out circumstances for additional guarantee issue policies, periods. So the individual was enrolled in health benefits under an employee benefit plan, and that plan terminates or ceases providing supplemental benefits. Okay, that's a scary thing for everybody, right? You are receiving your retiree benefits and they go away for whatever reason. Just know that you will get 63 days to purchase a Medicare supplement without underwriting. In a situation where an individual was enrolled under a Medicare supplement policy, you decide to try out an Advantage plan, you don't like it, and you want to go back to your Medicare supplement, you can do that within the first 12 months. And an individual, upon first becoming enrolled in Medicare Part B at age 65 or older, enrolls in a Medicare Advantage plan and disenrolls within the first 12 months, you can also receive a 63-day issue period to purchase a Medicare supplement without underwriting. Next slide. Next slide. Again, I'm not going to read all these. Just know that they're there, know where to find them, etc. The guarantee issue period does last 63 days. The birthday rule lasts 30. The initial period lasts 6 months, but most of these guarantee issue periods are 63 days. And I do have a question in the chat. Does the initial supplement plan 6-month enrollment period start from the submit date of the Medicare Part A and B enrollment application or the date the application is approved? Your 6-month enrollment period begins the day that your Medicare Part B begins, which is usually the first day of the month in which you turn 65. So my example was turning 65 on March 15th. Your Part B would begin in most cases on March 1st, and that would be the first day of your 6 months. However, that does not mean that you cannot start shopping well before and have that policy in place so that policy starts on March 1st, because that is ultimately what you would want in almost all circumstances. Next slide. All right, so gonna just roll through this quickly. If you're in a Medicare Advantage plan and your plan is leaving Medicare or stops giving care in your area, or you move out of the plan service area, you're gonna get 63 days. Next slide. If you have original Medicare and an employer group plan, which I mentioned, and that plan is ending, you're gonna get the 63 days. And COBRA as well. Next slide. You have original Medicare and a Medicare Select policy. You move out of the Medicare Select policy service area, 63 days. Next slide. You join a Medicare Advantage plan when you were first eligible for Medicare Part B at age 65, and within the first year, you want to switch to a Medicare supplement. You get 63 days. However, this right is not granted to those under 65. Next slide. Is a trial right. So you had a MedSup and you were convinced to try out a Medicare Advantage plan. You weren't happy with it and you want to go back. You can go back to the original plan that you had before. If that plan is not available, then there's another list of plans here that must be offered to you as well. 63 days as well. Next slide. Your Medicare supplement insurance company goes bankrupt and you lose the coverage, or your Medicare supplement policy coverage otherwise ends through no fault of your own. You can choose another plan and you have 63 days without underwriting. Next slide. You leave a Medicare Advantage plan or drop a MedSup policy because the company hasn't followed the rules or it misleads you. You need to file a complaint with us. You need to file a complaint with CMS. You can't make this determination on your own, but if it is determined to be true, 63-day guarantee issue period. Next slide. All right, this is a new one, and this is a Maryland state law. After a public health emergency ends, you are terminated from Medicaid more than 6 months following the effective date of enrollment in Medicare Part B. And so in this case, during the public health emergency, people were not disenrolled from Medicaid who would have typically been disenrolled from Medicaid and had to purchase a Medicare supplement. They were allowed to stay on Medicaid and in fact couldn't be disenrolled from Medicaid. And so their 63-day guarantee issue rights started when they essentially lost or will lose Medicaid. So this is an ongoing situation. Many people who've enrolled in Part B still have those Medicaid benefits. They have not lost them yet. And I just want to say, if anyone has any questions regarding that, you can shoot me an email and I will try to help you or send you to the SHIP that can help you with your issue transitioning onto the Medicare Advantage or the Medicare supplement. Next slide. All right, so some frequently asked questions. What is required from an insurance company to justify a Medicare supplement rate increase? Well, they have to file annually and they have to demonstrate compliance with loss ratio standards. The insurance company must provide additional data if they are requesting a rate increase to prove that that requested rate is reasonable, equitable, and adequate. They have their professionals called actuaries that are doing this math, and we have our professionals, we have our actuaries on our end that are checking their information and saying whether or not we're going to approve, not approve, or adjust a rate increase request. So that is the staff of the MIA's Office of the Chief Actuary. They review the documents. The premium rates are compared with the benefits and the current experience to determine whether we approve, deny, or adjust a proposed rate increase. Next slide. The Medicare supplement rates can be increased only once per year for each insured. Vision and dental care are generally not available under Medicare supplement plans. They don't cover vision, dental, hearing aids, or eyeglasses in most situations. If you have a health problem, your Medicare supplement plan cannot drop you. Your Medicare supplement policy is guaranteed renewable. That means that your insurance carrier cannot cancel your policy unless you fail to pay your premiums on time, or you make a material misrepresentation, which is a fancy insurance way of saying you lied on your application. Next slide. There is information available about complaints against insurance companies offering the Medicare supplement product. This link is updated. This information is available from the National Association of Insurance Commissioners. Can I keep my current Medicare supplement policy or switch to a different policy if I move out of Maryland? We do touch on this earlier in the presentation. In general, you are allowed to do so. Call, talk to your insurer. And again, remember, Massachusetts, Minnesota, and Wisconsin have different policies. Next slide. Financial assistance. Is financial assistance available for the Medicare supplement policies? There are no programs available to help with the cost of the Medicare supplement plans. If you need to speak to somebody about Medicare and financial assistance, please reach out to your local SHIP office. The State Health Insurance Assistance Program, SHIP, is a free program to help those on Medicare with personalized Medicare counseling, education, and access to financial assistance resources. There is no financial assistance available for the Medicare supplement plans, but there is plenty of financial assistance available with Medicare. There's the Medicare savings programs that help you essentially pay that 20% if you qualify for QIMBY. The SLIMB program pays for your Medicare Part B. There's extra help that pays for the cost of your drugs. And there's a Maryland specific program, the Maryland Prescription Drug Assistance at SPDAP. There's another program that is specific to Maryland that helps moderate income Marylanders pay for their drugs. So extra help skews toward lower income, but the Maryland specific program helps individuals with incomes, I think even above $50,000 a year at this point. It will help you with that premium for your Medicare Part D. So if you are lower income or moderate income, you should definitely reach out to SHIP at some point and make sure that you're getting all the financial assistance that you should be receiving. I currently have a Medicare supplement policy, but I just recently qualified for Medicaid. I'm not sure how long I'll qualify. Can I go back to my Medicare supplement policy later? You can suspend it in a situation like that for up to 2 years. You need to notify the carrier within 90 days of enrolling in Medicaid, and then you reinstate your policy by notifying them within 90 days of the date that you became ineligible. Next slide. All right, additional resources. There's always 1-800-Medicare. They can answer your questions, but I mean, I think your first call should be to your local SHIP, and those resources are below with that link. The Medicare Rights Center and the Center for Medicare Advocacy. If you're a person who likes to answer your questions on your own, or you're like, go down the rabbit hole of various Medicare trivia, and it's something that you like to do, I highly recommend those 2 pages. I use them a lot to get answers to Medicare related questions. They're both great repositories of frequently asked questions and general Medicare information. I do have a question in the chat. How does this go for people who are on Medicare due to disability once they turn 65? If you mean the Medicare supplement products themselves, I don't know if maybe you missed part of the presentation itself, but if you are on Medicare due to Social Security disability, there are options for you. I think at this point it would be a review of a lot of the things that we already covered. So I highly recommend, I'm going to put my email address in here again. I highly recommend that you shoot me an email so we can talk about your situation in detail. And then maybe I can get you over to one of the ships. Next slide. All right, there's the ship offices. If you want to scratch down your own number, again, you can find that information in a whole bunch of other places as well. And at this point, I just want to say, if you have questions, put them in the chat. We will start Q&A session. Again, if there aren't any questions, that's fine. I'm going to give you a minute to let you write down your ship number. Next slide, Joyce. Our contact information, 800-492-6116, insurance.maryland.gov. We're on Facebook, LinkedIn, Twitter, which is now X, Instagram, and YouTube. That's my favorite. We got all kinds of videos on YouTube. Next slide. Website, phone number, 1-800-492-6116. And questions, Q&A. Anybody have any questions? If you don't, I think Joyce is going to put up survey. And a link if you want to follow us, get information about our upcoming events, etc. But I just want to say, everybody, thanks for being here. You have my email address in case you have other questions related to the Medicare supplements. Feel free to shoot me an email. Okay, I have one question. My friend's birthday is 7/14. She submitted. You're welcome, Ruth. She submitted Medicare Parts A and B enrollment application. She has not received card. How? I would call Social Security in that situation. Her birthday is 7. She has not received. Yeah, that sounds like a relatively urgent situation. She is going to need to get in touch with Social Security. I don't know if anybody's on from the ships who would have any better advice than that, but that is my advice to you. September, she submitted. Social Security office said that the processing is slow. She has 12 months, not to worry. Okay. All right, any other questions? If not, I'm going to say thank you all for attending. If you want a copy of the slides, shoot me an email. And I hope everybody has a great day.